Hello, everybody. You're very welcome to a new Redefining Cybersecurity podcast. I am Sean Martin, your host. I may not sound like myself today with a bit of a grovelly throat, but it is me. And I still get to talk to the coolest people about the coolest topics, all in support of, well, generally helping the business create a safe and secure business and protect the revenue that it generates. But when businesses touch society and humanity, it's also protecting those things as well. And we had a great webinar not too long ago on the topic of AI in healthcare, and a fantastic panel. And one of the panelists has agreed to come back and have a deeper conversation with me. Jim St. Clair, it's a thrill to have you on. Pleasure here, my friend.
Yeah, no, the pleasure's all mine, Sean. I greatly appreciate the invite for the first panel session. I thought that was all star, and an honor to come back and chat with you a bit more and groove on the topic.
Absolutely. So so it was a good panel. I'll include a link to that so folks can watch that on demand. A lot of great information there from provider and payer and operations perspective, security as well. So Jim, just to kind of refresh folks, if they saw that, or let them know who you are, new if they didn't see that, and just who you are, what you're up to these days.
Sure, absolutely. I am the Vice President of Public Health Systems at Altarum Institute. It's a nonprofit. We've been around for a lot of decades with a specific mission to support public health agencies and public sector healthcare. Obviously interactions with federal healthcare, HHS, CDC, other federal agencies and HHS agencies, and then state and local public health agencies. Which in my division, we do interoperability, IT solutions, integration and engineering, and of course, with that context, steering the division in the direction of artificial intelligence and machine learning to be able to support for public health and public health data.
Yeah, a lot of great stuff there, and I'm sure there's a lot of little branches or leaves that come off all the things that you just mentioned as well. So you reminded me of the interoperability thing, which is part of the conversation we had on the webinar as well. What are you seeing? Well, maybe big picture AI, but I think ultimately I want to get to some of the interoperability things, because data and now access to the data through AI means we have to have all these systems connected. But I guess let's back up for a second. We won't go there yet. What are you seeing and hearing in terms of public health and AI being part of those conversations? What are they looking to do? Do they have purposeful ideas, or are they saying, here's AI, let's go explore? What's some of that state of the union, if you will, in that regard?
Yeah, and I'll break down into some tiers and some stratification. Obviously, the first challenge is that public health has a real challenge at the moment, right? The primary sources of funding and initiatives such as data modernization and the like have been subject to a lot of challenges and variation in the last few weeks, the last couple months. So we are trying to work very closely with all of our various clients, federal, state level, et cetera, to help navigate that. So there is some dust settling that has to take place with that over time, and kind of see where things are going next. Even so, what we have historically been engaged in and so far fortunate to stay engaged in is helping a lot of public sector organizations continue what was brought about after the pandemic in the way of modernizing systems. And with that comes a lot of interoperability. So there's been a tremendous amount of work done both nationally and globally with new data standards, health IT standards, certified electronic health record systems, et cetera, that create new ways to generate better interoperability and data sharing. And there are various software products, various data standards and the like that we leverage to do that. Within public health, there's a number of use cases around registration of the registrar. So things like births associated with birth certificates, deaths, other disease surveillance. All of those are very important, almost daily points of information that public health agencies work with to be able to provide reports and statistics and generate other data. And we've been integrating a number of different solutions that increase that interoperability. And what it comes down to is any public health agency having access to data easily and easily generated from someone coming in to see their doctor or the local coroner reporting who's passed away. Interoperability in a lot of cases isn't just about the exchange of data more easily, but being able to report that data more easily and make that data available more easily, so that it isn't some manual process or log into three different systems and provide information. So all of that is continuing to be underway. And then leading up into AI, as we talked about in the panel, as well as I'm sure what other people are seeing, how does AI and enabling processes with greater automation, with greater analytics, benefit some of these processes for collecting data? Once you've collected the data, once you've improved interoperability, what can you do to draw better conclusions or better predictive analytics? And that's where I think AI is starting to take root.
So the reporting thing is interesting to me, and there may be something there or not. I don't know. You'll tell me. Do public entities have a greater requirement to report on stuff versus the private health sector? In terms of, I don't know what the obviously how many new births, how many people die, maybe some stats on measles, just to pick something, or I don't know. I'm assuming those are the types of reports. Are there different requirements for the different agencies separate from
Yeah,
private?
great question. There's a number of requirements like reporting to the the part of CDC still functioning around vital statistics and collecting all of that information. And then there is what the specific state laws and regulations are around how that data is collected. And then lastly, of course, is you don't want to come up with yet another requirement for a physician to stop and have to submit this report or process more information or something along those lines. So it's a combination of both what regulations are required are requiring for data to be collected. What is it that states want to be able to see and understand for their state populations? And then not coming up with yet one more thing to ask a physician to have to do. So make it easy to be able to get that information from the HR or pushing a button for submitting a report. Make that information readily available for the state public health agency to work with for their own benefit as well as for whatever their federal reporting requirements are. And then lastly, what does that information tell you? Just for instance, this past week, talking on topics of cancer registries, where we're doing some work in various states. The states are meeting their requirements and they're looking to increase their interoperability and collection of information for cancer registries, but yet the reporting requirements say you've got up to 18 months. So when you want to know, hey, in the last month, how many people got cancer in this zip code, you've got to wait 18 months before all that information is put together. And that's not to blame on the system or the people sitting in front of the consoles. That's just the nature of the procedures and the regulations they are right now. So, is there valuable information that may be collected more efficiently or more timely to get new public health answers that aren't being collected at the moment?
So is this a question of, so it's so it's not the people, not you said it's not the system necessarily. I'll question that, but I guess maybe it's more the the policy
Yeah, so in people,
and the
process, and
law.
technology, it's
Yeah.
process and policy. Yeah.
Okay. Yeah, because what I'm thinking is, I'm sure there's a lot of legacy stuff, especially in the um, public sector, right? You don't have a lot of money to redefine things and redeploy new things and tear down old stuff, kind of keep it all in place. So I'm just wondering if there are reporting requirements that are antiquated. So we're not asking the right questions, or we're not reporting on quote unquote the right things. and we're just carrying that legacy stuff along, and therefore we're not getting the most out of our data?
I
Is that
I think actually that's a great question to ask, because I think since the pandemic and with the advent of all of the modernized technology that we are working on, and the number of public health agencies that have made great strides in getting rid of legacy systems or improving their data collection, then the question becomes, well, what is public health information? What does public health do? Um, and I'll take a radical approach for a second, just for internal discussions, as we look at these political arguments about, are they going to cut Medicaid, or what's going to happen to Medicaid? Well, is there public health information within Medicaid that can be used to improve population health? Are there predictive analytics that would help guide how money is being spent on the Medicaid population? As as commercial healthcare moves to what they call value-based care, and Medicare Advantage being a big example of value-based care, how do we collect the right population health data for Medicaid to be able to make better value-based care decisions for their population? And that means, what are we collecting from the Department of Health? What other information can public health collect? And then what do we do with that information, and how do we look at it and slice and dice it various ways?
yeah, and I can only imagine. I mean, a lot of the questions I presume are operate more efficiently, cut cost, reduce waste, prevent fraud. I'm sure it was in there somewhere. Hopefully, deliver care
Hmm.
measurements are in there. Better care is in there as well. But even those are fairly tactical and aren't a broad set of things of what what can we do? How do we change the way we look at this
Right.
and ask a question of, with all of this data, what is possible, and how do we ask the right questions that aren't tactical but are strategic in nature, so that we can. And then there's the next part: what do we do with it when we have some data to work with, some info to
Uh,
work with?
Absolutely right. And there's a colleague of mine, Trey Rawls from Optin, who publishes a weekly Substack, sometimes a couple times a week, fairly prolific. And he wrote a real good one, I think, that I read Sunday, about applying first principles thinking. So if we look at AI and interoperability and big data as ways to rethink the information we have available, the knowledge we can develop for it, well, what is a first principles way of looking at how we're doing an entire process, or what we do with the data we're collecting, or the answers we're trying to get? And there are lots of examples, and EHR being a good one, where in some respects it just was an electronic form of the way you kept a paper chart anyways. That's not a true transformation or first principles rethink of how you collect information and manage it for a patient. Now, there may not be perfect answers there, but just rethinking in terms of first principles, what is it fundamentally as an organization we're trying to do in population health and public health, and disseminating information for diseases or chronic conditions? And how can new technologies help get to a better first principles way of addressing that?
And yeah, so then the other thing I'm thinking, and I don't know why it just popped in my head, but I've had quite a few chats with our common good friend, Mr. Mike Parisi,
Hmm.
on the topic of Tefka. And I think I posed a question, I don't know, a number of weeks ago, and nobody replied. Thank you very much, everybody on LinkedIn, for not replying. I was just wondering I wondered then what the status of Tefka was. I could probably venture a guess now.
Well, as of right now, it is still officially in the books. There was some misinformation or
Mm,
disinformation that the Sequoia project contract had been canceled, and in fact, it's been confirmed that's not the case. There's still ongoing processes with the existing qualified health information networks, so it's not ruled out yet. But there is. I think that there are legitimate concerns and questions about where it continues to go with support and sponsorship from this administration. But that doesn't mean that organizations that haven't become qualified health information networks will just stop overnight. And I think that the momentum is starting to build a bit.
Okay, because I have a feeling that's a huge part of finding success in this bigger picture, is having that common system, right? Maybe for folks, I'll butcher it if I try to describe it. Can you describe TEFCA for the folks
Yeah,
out there?
that's the Trusted Exchange Framework and Common Agreement, which is a framework for information exchange that the what was the Office of the National Coordinator, now the Assistant Secretary for Technology Policy, ASTP, and HHS, came up with a mechanism that was part of the 21st Century Cures Act, all aimed at building national networks for exchanging health information. Now, I think as a what I call myself as a self-described HIE guy, I think there's always been an open question as to the roles of the QNs and national networks relative to HIEs. But I think most everyone would agree diplomatically that they can function harmoniously together for various reasons. Um, but
And the HIE is a health information exchange. Those are state level. Is that right?
Those are state level, and
Yeah.
in the cases of some states, they you may have more than one. In the case of Texas, they passed their own law around the data exchange framework and have multiple health information organizations, what they call QHIOs, specifically for service within California to serve California population. Texas also has several different HIEs as well, but I think when you look to those biggest states between New York and Texas and California that really cover the most geography, it's natural that they're a bit more federated. Other states like Michigan, of course, has the Michigan Health Information Network. Delaware, Maryland has CRISP, so they may have a singular state entity supporting them with some sub entities underneath. Um, but yeah, as I was saying, I think most everyone agrees that as defined so far, they can be harmonious. And the most important thing is that when somebody wants their information to go from point A to point B, that there's the right switchboard between AT&T, Verizon, and Sprint to be able to make it all work. So
Yep. Yeah. So I'm wondering how AI can fit in here. I mean, we could probably plug it into every spot somehow, some way. Um, are there opportunities? I'm just thinking of this complex network of systems and data sets, and if there's interfaces and frameworks and everything has to line up properly, and it could take forever to do it. Maybe a simple, quote unquote, simple AI API call
yeah, yeah,
as as a bridge to some of this stuff could be a nice stopgap to help connect some of these things, as long as security is part of that equation, of course. So I don't know. It's just coming to the top of my mind. What are you thinking in terms of AI and how we can, because there's population health, right? So the broad, and then there's precision health,
hmm
which AI, I presume, can help with that as well. So where do you think some of the investments, and there's probably other areas, but what are some of the investments you think are coming down the line?
yeah. At Altarum, we're going out with a basic message around kind of five different use cases within public health that we think are low hanging fruit or can bear fruit for AI around public health decision support platforms. Using algorithms and ML to assist in analyzing data and helping to come up with courses of action or better understand next steps in a scenario. Community Health Intelligence Suite, and ASTO, the Association of State, Tribal, and Healthcare Organizations, actually just did a good webinar today talking about AI enabled tools for community health workers and community health agencies. Um, Workforce augmentation. And of course, this is very similar to workforce augmentation that we're looking at in healthcare as well as other industries where, how can the AI chatbots or AI agents help enable conversations or individual engagement or communication strategies. One of the things we've talked about recently is you have certain communicable diseases, and of course, there's always been a public health reporting requirement around that, and public health agencies collect that data and they report on it. But what if you have AI tools that help you with that reporting and collection and understanding that then translate into targeted communication tools? Hey, these communicable diseases are coming up in these specific zip codes. affecting these demographics and populations. What can we enable through chatbots or other means to be able to communicate to those populations through, popular messages or social media or something to make them more aware to be able to address a health challenge or be more aware of a challenge that they have for a communicable disease in the area. That could be an AI enabled workforce augmentation that would have taken 4 or 5 people doing tasks that now could be better automated by AI going forward. We're also looking at AI enhanced emergency response coordination. Maybe that's a combination of GIS data being leveraged by large language models in conjunction with other emergency reporting data to be able to be more actionable in disaster areas and storm response. Something I concern myself with here being in a hurricane zone. And then, as you mentioned already, predictive population health management, where we strayed a bit about saying, hey, you've collected all this data from various registries, from various reporting on various conditions. How can we translate that into population health information that provides predictive analytics that help us make healthcare investment decisions or Medicaid decisions?
And so this is your guidance, those 5 things, which are fantastic. Um, how do different public entities take those first steps? Is it all over the place in terms
Yeah.
of who's moving how and where and why? And I'm sure a lot of it's driven by funding, but I also presume there's some understanding and skills gaps that may impact some progress. What do you think?
Yeah, and I think that it is, of course, early days. It's kind of early days in health. Well, so let's talk about AI in healthcare more broadly, where at the macro level we say, oh, early days, slow adoption, things aren't really coming along. But if you read the Journal of the American Medical Association, which has a dedicated AI section, there's all kinds of cool things that different hospitals and academic medical centers are doing on their own. There may not be wide adoption, but if you just look at, say, empirical results or what they were choosing to try and sample with AI and do, I think it holds lots of promise for the future. I think public health agencies are in a similar position, realizing, of course, we started off by saying the immediate challenges that we all are facing with regards to budgets and just government investment. Um, but there's potential for the next generation of tools and what they continue to adopt to be able to leverage some small portion of AI, maybe a larger Gen AI implementation for managing their data, all of which are there for consideration. I think what I'd like to think is that the barriers to entry are relatively low if you consider them. There's been lots of technologies in the past that just getting your hands on something like a certain server or a certain router or a certain piece of software wasn't as immediately achievable and leverageable as you can sign up for a free ChatGPT account right now.
Yeah, exactly, and it just makes me wonder what. Yeah, I presume there's a lot of requirements. I'll call them requirements for things that need to get done or built, or we have all these systems. We replace them. There's still a list of things we never got to,
Hmm.
and some of it may be because the system doesn't support it or whatever the case may be. I'm thinking of the scenario that's coming to mind is like remote health, where doctors and nurses go out and visit, and they have a set of people they're going to go visit at their home health, I guess I should
Hmm.
say.
Home health or remote patient monitoring.
Yeah,
Yeah.
yeah. And so how do you schedule those calls and visits and I would imagine setting up logic to do that manually would be hard. Using AI could be easier. Um, that's probably a lame example, but
I think it's a great example. And if I could elaborate on it for a
sure.
second, um, I think you just described the scenario. So let's just say, for argument's sake, it's three people in a rural area that have responsibility in some fashion to follow up on whether it's home health, remote patient monitoring. Um, can all three people cover the geography necessary to get to
Mm,
the necessary number of patients? How many of those patients lack the resources to be able to get to some healthcare center to be seen versus having someone go to their house? There's a whole range of remote patient monitoring tools, and not just the wearables and the Fitbits, but real live medically approved wearables that and remote patient monitoring that get reliable data that really just pose a challenge if you don't have something like big data and AI to potentially do analysis for you. So you could have whether it's prompts or agents set up that query for specific information or are looking for trends or let me know when Mrs. Watson has another AFib episode as an example, and that information is fed back that help tailor and improve or augment what those three people have to be able to do every day. I like to use the term force multiplier because it's a moniker we had from DoD because we'd say, well, with this weapon system, it's a force multiplier. I have this one weapon. Instead of sending in two squads of troops, I have this one weapon, so that makes it a force multiplier. Okay, well, instead of sending in two squads of healthcare workers that don't exist, and I've only got three, my one weapon is an LLM or a trained multi-agentic framework using all of this collected data to help answer questions and analyze things for me to tell me what I need to focus on for priorities.
I love it. I love it. So, are there? Uh, there must be the companies building some of these systems for public health entities to use. They're not public entities aren't building this stuff themselves, are they? Or maybe they are. I don't know.
Well, yeah, that's a super question, and I think it speaks to the industry in general. You can go out and you can buy Gen AI. You can get a subscription to Claude or get a subscription to ChatGPT or Gemini Pro or whatever, and then you do something with it. It's still just a subscription like anybody else. And then there's a multitude of vendors that may be offering you tailored AI capabilities to do a function, to write a document, to review information, etc., that are built on those same generative AI platforms. And then you have the cloud service providers themselves, the data center and technology providers, AWS and Google with the cloud platform, Microsoft Azure and their AI work. And they're offering you enterprise type AI solutions where you're doing things with their computing and cloud platforms that you can benefit from what their AI that's built in has to offer, which is more of what we're doing with our initiatives at Altarum. So you really have the choice of kind of, and then I guess the last one, which last but by no means not least, is of course the open source, open model world that allows you to download and run your own if you want, or set it up in an instance of a cloud. And I would offer, if you look again at some of those publications in the Journal of American Medical Association AI sections, a lot of those efforts, they've built their own machine learning models or they've done something with their own algorithms. They have rolled their own completely for research purposes. In some cases, because you obviously have the most control over that, and in others because they may have a commercialization opportunity. So they can in turn that into a commercial AI platform and offer it as something that's explicitly applied for, kidney dialysis or cardiac monitoring or something like that that they could use. So it's kind of, again, it's also very very much like we were talking about before. It used to be if you needed a copy of Oracle database, you had to go and buy a copy of Oracle database, and that was the only way to use it. Now it's like, well, I need to do something with AI. Okay, well, here's the 6 different ways that you can approach, identifying, utilizing, implementing AI, depending on what you're calling AI to be in the first place.
Yeah, and so here's a question because we're at roughly 30 minutes here. Um, so my audience primarily security leaders and chief security officers, chief information security officers, practitioners, and business leaders as well. And so I want to connect this for them. So clearly, if they're in the healthcare space, they probably know a lot about what we talked about. But what might, let's look at it from two different ways. Well, let me ask a question first. Business leaders in public health, are they still doing what's right for HIPAA, high tech, and privacy in general? And well, let's answer that first, and then I'll go to the CISO side.
Yeah. So in the context of our
Yeah.
clients, we have our own secure cloud network that meets NIST and many of the FedRAMP requirements, specifically to support PHI, controlled unclassified information, that sort of thing. So we have taken that seriously because our clients in the public health agencies are taking that very seriously. And I would say to you, as
So they're
somebody who's
not they're
been
not laxing because they're chasing the shiny new thing, and they'll get to the privacy stuff later. Are they
Yeah,
holding
no,
on to the course?
that's a great way to ask the question. I was about to say that I have been a little bit surprised, and I guess I like the fact that more and more, say, state level requirements that we see, the states are now benefiting from the what's known as FedRAMP, that's called state ramp at the state level. So states have embodied NIST type security controls in their requirements and will offer, ask for something perhaps bright and shiny, but that bright and shiny still has to operate within a security control environment. And we're seeing that quite a bit. I think that's very heartening as a guy who believes everything that's done in the cloud should be done in a FedRAMP environment. Preferably FedRAMP moderate or high. So in that context, as we talk to clients about AI and doing things with AI, I like initiatives that involve generative AI, and I'm not here to bash generative AI, but generative AI is a rented service, just like any other online service driven by APIs. That's different than recognizing we want to get into AI as a public health agency, make it part of our knowledge management and our data governance, and saying how we do that in the context of FedRAMP, state ramp, high trust type compliance environments, which means selecting an architecture where you have more control over the large language models, the AI processing in the context of that environment. So those models themselves have a number of vulnerabilities. Of course, you're always exploring safety and security in AI, but if that's running contained within the enclave of your FedRAMP, state ramp secured environment, that's an entirely different risk management scenario than I'm just going to feed something into Chat GPT who promises me it's going to be anonymized.
All right, so that's great information. Thank you for all that. Let's switch it to the CISO now. So hopefully CISO and these entities are having conversations with the directors and executive leaders, uh, driving the boat, right, steering the ship.
Mm-hmm.
Um, but there's always going to be some form of shadow AI, I think, and the easiest is with the rent a service. Grab yourself a $20 a month usage, right?
Yeah.
Um, how do CISOs? Well, let's look at it two different ways. At the executive level, what kind of questions should CISOs be asking the executives to ensure that they're driving the right message down in terms of secure and safe use of AI? And then the other way up, what should they be looking for to see if there are signs of AI being used that's not, say, sanctioned or uh, completely well understood at the business and operational level? Two
Yeah,
different things there.
I think that's a great question. From my experience, I've seen lots of CISOs and have the pleasure to interact with quite a few that are working on getting those answers. So, for instance, the Healthcare Sector Coordinating Council, which is the healthcare industry representative group working with HHS and DHS around cybersecurity infrastructure protection. One of our nearest working groups is cybersecurity for AI, and that is starting off first by saying, look, there's a whole collection of publications and pontifications around reliable AI, trustworthy AI, secure AI. What does that mean? What are overlapping frameworks, or what are frameworks we haven't addressed yet from NIST, from ETSI, the European authorities, from ENISA, from whoever, the UN, about ways that AI should be controlled and risks of AI and things to be concerned with. And I think we're trying to synthesize that into easily understandable, actionable risk management tools for healthcare CISOs to use to understand if AI gets thrust upon them by leadership, these are things to look out for. Or, of course, ideally, they're asked at the table, well, what are some, we're interested in moving into AI strategically. Hey, CISO, what does that mean for us in terms of our security concerns, and how should we approach it safely and securely to begin with? And you always want to point to, speaking of my CISO days, you always want to point to a framework, a reliable standard, something that keeps you out of trouble because it's what everyone has adopted. And those are still evolving. I think my personal thought, the biggest challenge with AI is that, you got a box, and in that box is AI, and it's a neural network, and it's confabulating things and coming up with calculations, and how it processes the gazintas into gozadas is still kind of, mathematical confusion. And historically, you've had systems and you've had data control and system integrity to know, well, if I put one value in here, I expect to get this value out over here. And that's how I know the system was working right. You don't always have those controls now. So we concern ourselves with, um, LLM poisoning and data injection and some of these other concerns. But then what other frameworks can I look to mitigate that risk in terms of controlling either the checks that are involved, or how the data is entered, or what happens to the data while it's in there, and it doesn't leave these three servers no matter what. Okay, that's cool. How does my memory work with the GPU so it's not dumping memory content into an unsecure location or something along those lines? That all comes from just the combination of technical understanding with these frameworks and guidelines and controls.
Yeah, and I've had quite a few conversations on AI security, and I, people listen to the show probably heard me say a few times that I hearken back to my days in quality assurance, where you had a defined set of scenarios and use cases and inputs and outputs, and you had a nice box that you could test, and then
Hmm.
you try to break the box as well and mix stuff up inside the box, but it was fairly contained. And now there's no form like interface that people are interacting with. It's a free
Right.
form, free thought. There's vibe coding and all kinds of other vibe stuff going on. Uh, that it's not a single input, and to your point, it's not the same output. Not always the right output or an accurate output, and that's just from the data level. And if we start to think of it in the same context or in the same sense, but in the context of security and privacy in terms of access control and yeah, systems sharing information or exposing information. I think the way we look at it, security of AI also needs to be rethought in that sense, because
Yes.
it's not just a box where something's going in, something's coming out, and as long as I protect that perimeter, I'm okay, because there's a
Uh,
lot of
y-
stuff going on.
you're exactly right, Sean, and I mean that goes back to the turn of the century when we were still talking about defense in depth strategies, and from a military perspective, applying the way we secured on the battlefield to secure our networks. But it was largely whatever wire connected to another box was your various points of security. But now, as you were just describing, I think it's not just AI security. What you're really worried about is data and the data governance. AI is meaningless if there isn't data behind it. What you're worried about are the safety, security, integrity, availability of that data. And data governance has turned into a real challenge for an environment where data is everywhere. So
Yeah. So I don't. You described some of the vulnerability and attack services and methods. Um, are you, you think you could describe what I described for CISOs in a way that gives them something to work from, to think about differently as they redo or redefine their cybersecurity programs with AI in mind?
Yeah, I think NIST has some good guidelines. Unfortunately, I know, speaking for myself, it's an area that requires almost daily understanding, and of course appreciating that healthcare CISOs in particular have enough challenges just with their own environment before AI starts introducing new ones. Um, I think, and sincerely have not paid as much attention to it, but I think that AI for cybersecurity is also, rapidly growing too, which is, hey, these new threats are going to be too difficult to keep up with. So why not have AI as my friendly guard dog, being able to help watch what AI is doing in other places too. Um, uh, and uh, and I think most CISOs are pretty smart when it comes to understanding vendorware and whether or not there are real solutions to choose or to acquire or to build something or buy it, and that's all part of the game for development.
Yeah, all part of the fun and games. I drug you all over the place. You're amazing to follow along my
Yeah.
crazy mind
Well, we
bending
chatted
today.
before, so I kind of feel like
Um,
I know it.
I know you've been doing some research as well, and I don't want to go through all of it, but was there anything in there, because we didn't touch on it directly? Was there anything in the material you're putting together that stands out, maybe even in the context of what we discussed today, that you want to highlight?
Yeah, I think it's grown more and more important. Taking a look at the AI research stuff that I read and skim through every day to translating into real live AI adoption and where that gap is. I don't think you can understand the trend in multi-agentic frameworks. So there's still a very general understanding around AI being Gen AI, which means Chat GPT or an LLM. What multi-agentic frameworks are capable of doing, what smaller language models with multiple agents can do, is only just being discovered, and that's really where I think the cow is going to knock over the lantern and set the barn on fire.
Yeah,
So that'll be the
I'm with you.
next area to explore.
I'm with you. And I had an introductory for myself anyway, conversation on agentic AI and with a hint of cybersecurity. Ken Wang from OAS, I think he's AI
Oh
Exchange.
yeah, yeah, yeah.
Yeah,
Ken's a good guy.
and so he enlightened me. I mean, he's got deep knowledge. I learned like this much because that's all I can handle.
Yeah, yeah.
But
Okay.
uh, I'm with you there. The lantern getting knocked over.
Yeah,
I mean,
yeah.
we start talking about agents writing codes so the system works differently based on how it's prompted. It's going to be quite something. Well, that's a good advice. Thanks for bringing that up again and making my mind spin some more. Well, Jim, it's been great chatting with you, and obviously we could chat for hours, but we won't. We'll
Yeah,
let
yeah,
let
absolutely.
folks
But I enjoy our chats
ruminate
together.
on this, and we'll chat with you soon. So, thank you so much. Appreciate it,
Absolutely. Thank you so much. Good to
and
talk
thanks
to you,
everybody.
Sean. Appreciate the opportunity.
Absolutely, thanks everybody for listening. Stay tuned, subscribe, share with your friends and enemies, and we'll see you on the next episode.